The hypothalamus is classified as part of the brain, not an endocrine gland, but it controls the pituitary gland, indirectly affecting many other glands. The pituitary gland and hypothalamus act as a unit to regulate most endocrine activity. The hypothalamic hypophyseal portal system connects the hypothalamus to the anterior pituitary, allowing rapid transport of releasing and inhibitory hormones to regulate secretion. Nerve signals from the hypothalamus control posterior pituitary secretion. This video will explore the various hypothalamic releasing and inhibitory hormones. The pituitary gland, also called the hypophysis or master gland, is about 1 centimeter in diameter and located in the sella turcica. It is connected to the hypothalamus by the pituitary stalk and divided into the anterior pituitary, adenohypophysis, and posterior pituitary, neurohypophysis. Let's take a closer look at the anterior pituitary. The anterior pituitary, or adenohypophysis, is mainly composed of epithelial cells and develops from Rathke's pouch. It controls metabolic functions by releasing 6 major hormones: growth hormone, adrenocorticotropic hormone, thyroid-stimulating hormone, prolactin, follicle-stimulating hormone, and luteinizing hormone. The anterior pituitary contains 5 main cell types. Somatotropes secrete growth hormone, corticotropes secrete ACTH, and thyrotropes secrete TSH. Gonadotropes secrete LH and FSH, and lactotropes secrete prolactin. This video will now describe the various hormones produced by the anterior pituitary. Growth hormone, a peptide hormone, is stimulated by GHRH and suppressed by GHRIH from the hypothalamus. It causes growth of tissues, especially bones and skeletal muscles. It also stimulates protein synthesis, promotes fat breakdown, and increases blood glucose levels. GH secretion is greater during sleep and stimulated by factors like hypoglycemia and exercise. Secretion peaks in adolescence and declines with age. A negative feedback mechanism and GHRIH from the hypothalamus inhibits GH release. Corticotrophin-releasing hormone from the hypothalamus promotes ACTH release. ACTH increases cholesterol and steroids in the adrenal cortex, boosting cortisol output. ACTH levels follow a circadian rhythm, peaking around 8 a.m. Secretion is regulated by negative feedback and stimulated by stressors like hypoglycemia and exercise. Thyroid-stimulating hormone, or TSH, is released upon stimulation by TRH from the hypothalamus. TSH stimulates the thyroid gland's growth and activity, leading to the secretion of thyroxine and triiodothyronine. Secretion is regulated by a negative feedback mechanism with thyroid hormones. Prolactin prepares breasts for lactation. PRH stimulates its release, while PIH dopamine lowers it. Suckling stimulates prolactin secretion after birth. High prolactin levels can reduce the incidence of conception during lactation. Prolactin secretion is also related to sleep. Just before puberty, LHRH, or GnRH, from the hypothalamus causes the anterior pituitary to secrete increasing amounts of gonadotropins, which include follicle-stimulating hormone and luteinizing hormone. These hormones enable normal adult reproductive organ function in both sexes. FSH stimulates the production of gametes in both sexes. In females, LH and FSH regulate estrogen and progesterone secretion during the menstrual cycle. Rising estrogen and progesterone suppress LH and FSH. In males, LH stimulates testosterone secretion by the testes. Luteinizing hormone, or LH, regulates the female menstrual cycle and male testicular function. In females, the LH surge triggers ovulation. If pregnancy doesn't occur, LH and other hormone levels decline. Abnormal LH secretion can lead to reproductive disorders. In males, LH stimulates testosterone production, essential for sperm production and sexual function. LH secretion is regulated by GnRH from the hypothalamus and feedback from testosterone. Elevated LH levels can occur in conditions like menopause and pituitary tumors. We will now discuss disorders of the anterior pituitary gland. Hypersecretion of growth hormone is usually caused by a pituitary tumor. As the tumor grows, it can cause hyposecretion of other pituitary hormones and visual disturbances due to optic nerve compression. Excess GH leads to excessive bone growth, organ enlargement, and reduced glucose tolerance. Gigantism occurs in children with excess GH before bone ossification is complete, leading to extreme height, usually 2.1 to 2.4 meters, with normal body proportions. Acromegaly, meaning, quote, large extremities, occurs in adults with excess GH after bone ossification is complete. This results in abnormally thick bones and thickened soft tissues, noticeable in coarse facial features, enlarged tongue, hands, and feet. Hyposecretion can involve varying numbers of hormones, with panhypopituitarism being the absence of all hormones. Causes include hypothalamic or pituitary tumors, trauma, infections, necrosis, radiation, and cytotoxic drugs. Pituitary dwarfism, caused by severe GH deficiency in childhood, results in small but well-proportioned stature. Mental development is unaffected, but puberty may be delayed, and hypoglycemic episodes can occur. The condition may be due to genetics or a tumor. Let's explore the posterior pituitary gland. The posterior pituitary, or neurohypophysis, arises from a neural tissue outgrowth of the hypothalamus. It secretes antidiuretic hormone and oxytocin. These hormones are synthesized in the hypothalamus and stored in axon terminals within the posterior pituitary, released by nerve impulses. The main effect of antidiuretic hormone, or ADH, is to reduce urine output by increasing the water permeability of kidney tubules, thus increasing water reabsorption. ADH secretion is controlled by the osmotic pressure of the blood. Increased osmotic pressure, due to dehydration or hemorrhage, raises ADH secretion, retaining water and reducing urine output. Low osmotic pressure, such as after fluid intake, reduces ADH secretion. High concentrations of ADH or vasopressin cause vasoconstriction, raising blood pressure. Oxytocin stimulates uterine smooth muscle and muscle cells of the lactating breast during and after childbirth. Increasing uterine distension triggers oxytocin release via a positive feedback mechanism, causing stronger uterine contractions. Suckling initiates a positive feedback mechanism for milk ejection. Sensory impulses travel to the hypothalamus, stimulating oxytocin release, which contracts myoepithelial cells, ejecting milk. Suckling also inhibits PIH, prolonging prolactin secretion and lactation. Finally, we discuss disorders of the posterior pituitary gland. Diabetes insipidus is often caused by ADH hyposecretion due to hypothalamic damage or when renal tubules don't respond to ADH. This impairs water reabsorption, leading to excessive dilute urine, dehydration, and extreme thirst, requiring increased fluid intake. Thank you for watching this video on the hypothalamus and pituitary gland. Thank you for watching.